Good evening. I am Dr. SHEBAN, MBBS DCH, specialized from world famous Madras Medical College with 25 years of medical experience. Okay. Today, I would like to discuss some important clinical features of typhoid fever. Typhoid fever. So, I will categorize this disease into 3 or 4 steps. First, I will categorize how to clinically think whether I am having typhoid fever. Number 1, how to suspect typhoid fever. Right, number 1. Number 2, what are the modes of transmission of typhoid fever? What are the modes of transmission of typhoid fever? Number 3, how to prevent typhoid fever. And number 4 is how to investigate typhoid fever. Number 5, treatment of typhoid fever. Of this, the most important information will be prevention of typhoid fever. Prevention of typhoid fever is very, very, very important, right? So, coming to the microbiology, typhoid fever is otherwise called enteric fever. Shall I repeat? Typhoid fever is also called enteric fever. ENTERIC, enteric fever. This typhoid fever is mainly caused by Salmonella typhi. Salmonella typhi, and rarely it is caused by Salmonella paratyphi. Shall I repeat? This typhoid fever is mainly caused by Salmonella typhi and rarely by Salmonella paratyphi. Salmonella, SOLMONELLA, Salmonella typhi, TYPHI. Salmonella typhi and Salmonella paratyphi. Okay. So now, this Salmonella can affect all age groups. It can occur in any age group. Okay. It can occur in any age group. It can occur even in pediatric age group or adult age group or even in geriatric age group. This Salmonella can affect all age groups. It can affect both male and females. Okay. Because it is a communicable disease. It is a communicable disease. It can be transmitted from, I'll tell you how it is transmitted. Okay. Okay. So, the most common, even though there are many reasons for this spread of typhoid fever, the most important reason is fecal-oral route. Shall I repeat? Fecal-oral route. It means stool, that is motion, STOOL, is otherwise called motion, MOTION, or feces, FAECES. It is transmitted from the stool passed by human being, transmitted through water somewhere, and it enters into the mouth. That is called fecal-oral transmission by water. Fecal-oral transmission by water. It can also be transmitted by fecal-oral by insects. See, if somebody is passing their motion in the outdoors, somebody is passing motion in the outdoor. There are so many flies in the stool, right? In the stool. That flies, house flies, comes to our home table and our food is opened. It gets contaminated there. And we take and eat that. So, from the feces, via this housefly, it comes to our dining table and from there we take and eat. So this is also feco-oral transmission through insects, that is houseflies or any insect. But the most common is feco-oral transmission by contaminated water. Feco-oral transmission by contaminated water. For example, I'll tell you, somebody is passing motion in the outside, in the garden. Okay, somebody is passing motion, some typhoid patient or a typhoid carrier patient is passing motion in the outside. And a rain comes, a big rain, heavy rain. This water is transmitted to across the drainage and it will go to the nearby pond or nearby well, somewhere it will go. From there, somebody will go for bathing in that pond. When they go for bathing, automatically they will have some water inside the mouth. They will be spitting like that from the pond while taking bathing. So it transmits. Okay, that is feco-oral route by water. So somebody is taking water from the well, contaminated by this motion. That water they will bring to the home and without boiling they will drink. So that is called feco-oral transmission through water. So the main thing is feco-oral transmission is the important source of transmission of typhoid fever. That is typhoid organism. That is Salmonella typhi. Okay. So how will you suspect typhoid fever? How will you suspect typhoid fever? See, I'll show you. I'll tell you very easily. So normally if it is a viral fever, it usually responds by 2 or 3 days of ordinary paracetamol tablet. Right? But sometimes even after that, the fever is persisting more than 5 to 6 days. The fever is persistent more than 5 to 6 days. It's a very high grade fever. Very high grade fever. High grade fever. Too much of tiredness. The fourth is very, very important. Coating of the tongue. You should tell the person to see the tongue. Coating of the tongue. Coating of the tongue is an important clinical sign to think about typhoid fever. Then like any other viral fever, they will have severe body pain. And another important symptom is, usually in typhoid fever, sometimes they will have diarrhea. So that you can think of typhoid. Shall I repeat once more? High grade fever for more than 5 to 6 days, you can think. Okay. Number 2, severe headache sometimes, like ordinary viral fever, severe headache. Then I told white coating of the tongue. That is very important. Then sometimes there will be history of diarrhea. Then severe body pain, headache, loss of appetite. That means they don't feel hungry. If you have these symptoms, you can think of think of typhoid fever. You can think of typhoid fever. Right? You can think of typhoid fever. Okay. So now what you should do? If you think of typhoid fever, you should take the patient to your family doctor. you should take this patient to your family doctor if you suspect. They will do, usually they used to do 3 important blood tests. One, they might do a complete hemogram, that is they say CBC, complete blood count hemogram. Next, they might do a blood culture for typhoid fever, and they might also do another important test called Vidal test, Widal. Shall I repeat? They will do a complete hemogram, that is CBC. Next, they might do a Vidal test, Widal, Vidal test, and they can also do blood culture to diagnose typhoid fever. These are the usual 3 tests they used to do. Okay, and then the next part is the treatment part. How can you manage a typhoid patient at home? How can you manage a typhoid patient at home? Right. Number 1, he should be given adequate water. That means good hydration. Good hydration is very, very, very important. Number 2, good bed rest. You should give a good bed rest. Number 3, he must be given homemade healthy food. He must be given homemade healthy food. 4, he must be given boiled water to drink. Boiled water is very, very good because it kills the typhoid bacilli in the water also. So warm water is, you have to give hot warm water for drinking. Okay. Next, you should avoid refrigerated foods. You should avoid refrigerated foods. Shall I repeat? Good drinking water, that is good hydration. Warm water to drink. Healthy, balanced, home prepared food. Avoid refrigerated foods. See the urine output, whether this is passing 5 or 6 times of urination every day. That is good hydration. See the mouth is very, very dry or not. If the mouth is very dry, that means he is dehydrated. If the mouth is very dry, that means he is dehydrated, and you have to take this patient to the hospital for intravenous fluid. You must take this patient to hospital for intravenous fluid. Next, you must give the antibiotics, oral antibiotics to eat as prescribed by your family doctor. And you can give paracetamol tablets also as advised by your family doctor. Only these are the 2 medicines: oral antibiotic for typhoid fever or oral paracetamol for fever. So these are the things which you have to take care of a typhoid patient if he is very, very, very stable. If he is very stable, you can give 6 to 7 days course of antibiotic along with hydration, good food. Good food means balanced food, cooked food, no refrigerated foods, adequate hydration. See whether he is passing urine well. If he is having severe diarrhea, If he is having severe diarrhea and full dehydration, you must definitely take him to the hospital to see your family doctor and take his advice. If he tells him for an hospital admission for intravenous fluids and IV antibiotics, if he advises you to get admitted in the hospital for intravenous fluids, that is IV fluids or IV antibiotics, intravenous antibiotics, you have to stay in the hospital, get treated, then come home. I think I made it very, very clear. Because even though typhoid fever is very easy to treat by a doctor, I repeat, even though typhoid fever is very easy to treat by a doctor, if it is not treated early, correctly, it can have so many very, very dangerous complications. It can cause very, very dangerous complications. What complications? It can have severe diarrhea, dehydration, and its own complications. There is one very rare entity called typhoid ulcer perforation. That is very, very, very serious. Typhoid can cause typhoid fever, that is, can cause some local damage to the kidney also. They say pyelonephritis. It can also affect the kidney also. That is called pyelonephritis. Very rarely it can affect the heart also. That is endocarditis. Very rarely it can affect the heart. That is endocarditis. Very rarely it can affect the brain also. That is called meningitis. So, you have to be quite cautious and careful. Even though these complications are very, very rare, these complications are really dangerous to life. Did you understand? Even though these complications are very, very rare, it is very dangerous to life. Right? So, did you get an outline of typhoid fever? So, the last part which I am going to tell is the most important thing. How to prevent typhoid fever. The next part which I am going to say is very, very, very important, because you should know how to prevent typhoid fever. Prevention is better than cure, right? Okay. So as you all know, the most important prevention is typhoid vaccine. You can take advice from your family doctor and you can take vaccine. Even if you are an adult, you can take typhoid vaccine with discussion with your family doctor. Children routinely get their typhoid vaccines in their appropriate age, as you all know. Children, they routinely get their typhoid vaccine from their family doctor as routine. What I want to say you is, even adult, even if you are in a geriatric age group, if you are any age group, all age groups can take their typhoid vaccination in consultation with your family doctor. Number one, that is the most important preventive measure. Number two, since I told you fecal-oral route is the most important method of transmission of disease. Since I told you fecal-oral route is the important mode of transmission of the disease, you have to block that, right? So what you should do? Number one, you should avoid outdoor defecation. we should avoid outdoor defecation. Number one. Number two, you should always give hot, warm drinking water. That means always practice hot drinking water. Number four, all the vegetables before cooking should be thoroughly cleaned. Did you understand? All the vegetables should be neatly cleaned before cooking. In case you are eating some raw vegetables like lady's finger, some tomato, some carrot, if you are eating raw vegetables, it should be neatly cleaned, so that even if it is contaminated with the feces, that is motion of infected person in the water, in the farm, or somewhere in the transportation, even if these vegetables are contaminated with the stool or the motion during transportation, if you clean it with hot water before eating, you can prevent this contamination. Okay, next. Meat, any form of meat, because they say that it is transmitted, it can be transmitted rarely by eating contaminated meat of animals. For example, if a cow has suffered from typhoid fever, that is Salmonella typhi infection, and by chance you eat the meat of that cow, very rarely it can be transmitted. That is meat oral transmission. So the general advice is, any meat you purchase from the shop, it should be well cooked. Any meat, it should be well cooked. Fish, meat and eggs. Fish, meat and egg should be well cooked. Right? Next. The nails of your children, or our nails should be always neatly trimmed, especially children, because during rainy season, they used to go outdoor and they used to play in the mud. Sometimes this typhoid bacilli, due to motion contamination in the soil, it will enter the nail, and when they come home and they start biting, it will go inside. So nails should be neatly trimmed to avoid feco-oral contamination. Did you understand? Next. Milk should be highly boiled before use. Milk. Next. What is the next? Before every meal, hand washing is a must. Before every meal, hand washing is a must. Hand washing. Next. When you serve your food in the table, if it takes 5 or 10 minutes to come to the table, it should be fully closed, because of what? House flies. They sit in the motion of the typhoid patient in the garden. They come and sit in the table. So cooked food should be closed in the dining table. Okay, food should close on dining table. What else? I think I told everything. You have to hear this video once more. So I cannot repeat once more, okay? Because I thought and then I repeat it to you. So So you have to rewind the video and see once more. So anything I missed? Drinking water, nails, and avoid children. Next is avoid children playing in the mud, especially during rainy season. Okay, that is there. Then cooked, I told, boiled eggs, I told you should be get boiled. I think I told everything. So preventive measures are very, 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 very important. Preventive measures are very important because if a child suffers from typhoid one time, it can also have typhoid next time also. It can also have typhoid fever next time also because of the same routine cycle. That is fecal-oral contamination is the most common contamination. From the motion through oral, it goes inside. That is called fecal-oral contamination. Fecal means what? Fecal means feces, that is motion, that is stool. The medical word for motion or stool is feces. F-A-E-C-E-S. You can click in the net and you can just verify it. So that is it word. Fecal-oral contamination. So it is very easy. You have to break the cycle. To break the cycle, frequent hand washing before food, close the table, close the food in the table. Then what else I told? Important thing. All the vegetables should be cooked well. If you are eating raw vegetables, it should be cleaned very nicely. And one more thing I forgot, very, very important. Normally we used to give fruits for our children, right? Guava, apple, orange. We used to give fruits for our children. We do not know where these vegetables have been grown in the ground or they have transported. Sometimes they would have kept in the floor in the ground. Where there might be fecal contamination. We didn't know, we do not know. So, whenever you give fruits for your children, always wash it in hot water neatly. Then give them food. These fruits to eat. So, raw vegetables, everything should be very neatly cleaned in hot boiled water, and then you can give it to your children or even you can eat. So I think I made typhoid fever little bit easy, right? Am I right? Did I miss anything? I think I told everything. Vaccine. Okay. If you want to put typhoid vaccine, go to your family doctor and you can discuss with them. Okay, so I think I told them. So I'll tell one more point about my weight loss clinic. I am Dr. SHEBAN. I am running my weight loss clinic. So you can have this information. See, this is a 11th standard old boy. 11th standard old boy. I reduced his weight from 140 kgs to 70 kgs. I reduced his weight from 140 kgs to 70 kgs. Did you see? I reduced weight to 140 70 kgs. I totally reduced 70 kgs. You can have my contact number here. Okay, did you see my number? So I reduced the weight of this boy from 140 kgs to 70 kgs. So totally 70 kg weight loss. The speciality of my weight loss clinic is no protein powder, no juice, no tablets, no running, no skipping, no bariatric surgery, no protein powder, no juice. Then you can ask me, how did you reduce this weight of this boy? It is only by giving a balanced home food diet plan. I give them a balanced home food diet plan of all the food which you are routinely eating in your own home kitchen. So this is the specialty. I think I gave my number. In case if you want any enquiries about my weight loss clinic, you can call me. And I think I have made typhoid fever so clear to you. Stay tuned with Dr. SHEBAN. SHEBAN. Okay. You can see my spelling, right? I told you, no exercise. This is my number. Right? Stay tuned with Dr. SHEBAN. Thank you.